Hope your work week is off to a good start. You're watching COVID-19. I'm Min San Hee. The daily tally stands on the 300 level today, given the fewer number of testings over the weekend. Authorities claim this week's numbers will be crucial in setting the future course of social distancing guidelines as Korea begins its own inoculation on Friday. As always, let's start with the pandemic updates. So, what do you have for us on this Monday?
Well, Sunny, we're starting off on a better note than some figures we saw last week. But as you said, on the back of fewer tests conducted over the weekend, this caseload of 332 may not represent the current situation. Now, Sunday's test number stood at a little less than 18,000, fewer than the 27,000 tests on the day before and over 44,000 tests on Friday. Now, 313 of Monday's caseload were domestic infections with 19 imported cases. And with that, the total caseload here in the country has surpassed 87,000 and the death toll stands at 1,562. Now, by region, we still have triple digits in the capital region, Seoul 106 and 121 in Gyeonggi-do province, and then we have a mixture of single digits and double digits in the rest of the nation. Now, daily cases rose to the 600s last week, and then we are seeing a gradual decline here, but experts are not ruling out another surge in cases as the week progresses. Also, with the average number of daily domestic infections now standing at above the mid-400s, this also means that health authorities still have to decide on how to revamp social distancing measures as they are planning a revision to the current social distancing system along with the beginning of the vaccination program here in Korea. And speaking of which, we now have here the timetable of the vaccination program for the first quarter of the year. The first shipment of AstraZeneca vaccines is expected on February 24th and then on 26th. So this Friday, the first vaccination is expected to kick off. And on the same day, we will have COVAX facility vaccines shipped to the country. The first products will be Pfizer products, and separately in late March, we will also have Pfizer vaccines shipped, and those inoculations are expected in April.
I see. Meanwhile, so on the international front, I understand the U.S. marked a grim milestone with regard to COVID-19 fatalities.
Right, Sunny. The U.S. hit over 500,000 fatalities from the virus on Sunday local time. Devastating, historic, and almost unbelievable is how the nation's top infectious disease expert Anthony Fauci called the situation. So let's take a closer look at some of the death tolls around the world. Here, the U.S. as of noon Korea time has surpassed 511,000 fatalities, followed by 246,000 fatalities in Brazil and also Mexico, almost 180,000 deaths. And a quick look at the numbers of infections in some countries here around the world. The U.S. now at 28.7 million, followed by 11 million in India and 10 million in Brazil. And Ukraine over the weekend has surpassed 1.3 million. And the total number of infections around the world stands at 111.9 million, with over 306,000 cases reported in the past day. And those are the numbers I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so I'll see you back in a bit. Right, staying on the international arena, Japan has confirmed a new variant of the coronavirus that has infected close to 100 people, mostly in the Kanto area of eastern Japan. Now, this finding comes amid the launch of the country's inoculation drive last week. For more on the COVID-19 situation there, I have Professor Harumi Gomi at the International University of Health and Welfare live on the line. Welcome, Professor Gomi.
Thank you.
Professor, let's begin with the vaccination campaign that kicked off, last Wednesday, with healthcare workers like yourself among the first to be inoculated. How is the campaign progressing?
Well, so far, the government plans to vaccinate first 40,000 medical professionals, followed by other medical professionals. It's going to be like 4.7 million people. And then, starting in April, elderly people will get vaccinated. That's the current plan. But although, since we do not have the solid confirmation of shipping of vaccines yet, this is the so far a tentative plan by the ministry who is in charge of vaccination.
I I see. Professor Gomi, what has been the public response to the government's vaccination efforts?
So far, as far as I know, there is a recent survey, and over 60% of people agreed to get vaccinated. And among the medical professionals, including our institution, over 90% of the people agreed to get vaccinated so far.
I see. Have there been any reports of side effects from the vaccines thus far?
As far as I know, in Japan, not really. As you know, anaphylactic reactions have been reported in many other countries. However, so far in our country, approximately 5,000 people, medical professionals, were vaccinated as of February 19th. And then so far, I don't hear any serious adverse events from the people who are vaccinated.
I see, Professor. Now, Japan's health ministry has vowed to pay more than 44 million yen, which is about $419,000 to the family of a person who dies from COVID-19 vaccine side effects. Has this stance served to boost public confidence in the vaccination campaign?
Well, probably I might have mentioned before, but vaccine policies have been very difficult in Japan due to the past adverse events with different vaccines. And then the government currently offers the vaccines free of charge for everybody. And well, I don't know, I'm answering the question.
Right. Professor Gomi, I was just wondering, as a health professional yourself, what are the prospects of people being vaccinated ahead of the Olympics this summer in Japan?
So far, we're not sure if we can, and all the Japanese citizens can get vaccinated or not. It all depends on the vaccine availabilities. However, the government trying very hard to vaccinate a lot of people, as many people as possible, once we get the vaccines from the companies. Currently, as you know, we have been using messenger RNA vaccine from Pfizer that is approved, and then another vaccine from AstraZeneca is still under approval processes. So therefore, whichever the vaccine comes first, the government is now trying to provide for the people.
I see. Meanwhile, Professor Gomi, what can you tell us about the new variant of the coronavirus that has recently been detected over in Japan?
Right. Well, starting back in December, we studied to identify variant from the UK, variant from South Africa, and then variant from Brazil. And then recently, we did identify variant from mostly domestic sources. So, and then we're not sure if those variants can be prevented by the current vaccines, but the government trying very hard to survey, to monitor the prevalence of variant strains. That's all I can say for now.
I see. Then how are authorities responding to concerns that the variants may limit the efficacy of current COVID-19 vaccines?
Right. Well, we need solid data. I don't think at the moment we can tell if it's still effective or if it's less effective or not. We need to see how we need to see the progress.
Right, that is true. There are more questions right now than answers with regard to COVID-19. All right, Professor Gomi, thank you very much for making the time to join us live with your thoughts.
Thank you.
Right, back on the local front, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Monday. Now, as mentioned earlier, authorities are looking to revamp their guidelines on COVID-19 prevention after taking into account the recent uptick in daily cases. Now, meanwhile, the current social restrictions will be in effect until this coming Sunday, as our Soa mentioned earlier. The Greater Seoul area faces level 2 social distancing guidelines, while the rest of the country is under level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. The briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing for today. First of all, we have Commissioner Chung Eun-kyung with the explanation. Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of February 22nd midnight, we have a total of 313 new local infections and 19 new imported cases. And we had a total of 332 daily tally today added to the total caseload, and the total caseload now stands at 87,324. And currently we have 7,875 people remaining in quarantine, and there are 146 patients with critical or severe conditions, and we had 5 additional fatalities, raising the death toll to 1,562. The fatality rate is 1.79%. I extend my deepest condolences to the deceased and the members of the bereaved families. And as of yesterday, here are some updates on our domestic infections by region. And as of February 22nd, the domestic cases we have 313, and we have about 74.6% clustered in the capital area with 236 cases and 77 in the non-capital area. And here are some details of the cluster infections. And we also had average domestic tally about 448. And in Seoul City, in relation to the University Hospital, we have in Yongsan-gu we have 218 total cases, and in Songpa-gu district we have at a cram school 33 total cases, and in Gyeonggi-do province here are some cluster infections. In Gimpo City we have 13 new cases stemming from a family gathering, and Namyangju City we have the plastic factory. 9 additional cases have been confirmed, and a total of 271 people have been confirmed to date. And in Ujeongbu City and Seongnam City, in relation to a ball dance club, we also have many cases being reported as well. And we also are seeing more cluster infections stemming from these ball room studios and dance room studios. And also in Seongnam area and Yongin City, we also have the nursing hospital with over 30 added cases. And in Chungcheong area, we also have 45 total cases on an average daily cases. And in Boiler Factory in Asan City, we have also additional cases being confirmed. And in Yeongdong district, we also have 10 additional cases. And we also see that these people are foreign students studying here in Korea. And Honam area, we have 10 additional cases being added. And also we have about 17 cases on a daily basis for the past week. And we also have Jeonju City's cafe, which have about 9 cases. And also in relation to a car factory, we have about 18 cases being confirmed to date as well. And in Gyeongbuk area, we have 15 additional cases, and on average we had about 22 for the past week. And major cluster infections, we have the 3 family gatherings in Useong-gun County, and in relation to the spa, we also have a total of 62 cases being confirmed. And here are some trends of the weekly average. And we are seeing the average daily domestic cases standing at about 455, which is a 28.7% rise from the previous week. And during the past week, we had about 27.6 imported cases, which is hovering below 30 on a daily basis as well. And by region, we are seeing a 3-week of steady increase in the capital area as well. And in the non-capital area, in Chungcheong area, compared to the previous week, we have about 3.5 times the daily tally. And Honam, Gyeongbuk area, we also see a slight increase of the cases. And during the past week, we are seeing the sources of infections, and they are also about 32.4% are contact with cluster infection, and 27 stemming from cluster infections. And we also had last week many cases stemming from the university hospitals and a nursing hospital, and they account for about 12% of the total cases, and it stood at 404. And we also have about 740 or 29% under investigation. And as for the new cluster infections, we have 20 new cluster infections being reported during the past week, and 6 were family and social gatherings, 5 were workspaces as well. And we had 3 nursing hospitals and hospitals, and we also had many public facilities like spa and restaurants, and also 1 from Hagwon as well as 1 from a religious facility. And we are also seeing a steady decline of those in critical or severe conditions, and the fatality rate has decreased slightly from the previous week. However, we still have above 20% of fatality rate when it comes to those over the age of 80. And during the past week, we had 39 fatalities reported on a weekly basis. And as for those over the age of 80, there were 20 people. And as for the sources of infection of these fatalities, we have seen that 44.6% were stemming from the hospitals. And next, we would like to provide you some updates of the new variants of COVID-19. As of 20th of February, we have seen 85 tests being conducted. And also, as for these 85 tests we have carried out, we have seen 9 of them have been identified with the new variants. To this end, from October to right now, we have a total of 128 being reported here in South Korea, and 109 are from UK, 13 from South Africa, and 6 from Brazil. And as for the 9 new variants that have been identified, 6 of them were imported cases and 3 were local transmissions. And as for the 6 imported cases, 1 have been identified at points of entry, while the rest of the 4 have been identified while on self-quarantine, and the rest of the 1 person has been identified and has been exempted from the self-quarantine and has been tested afterwards. And all of these local cases have been identified in relation to a family gathering, and they were also all UK variants. And we also have the details here enclosed in the press kit. And the quarantine authorities are also increasing our monitoring and testings for these COVID-19 new variants. And we are making sure that everyone who are coming in from abroad to South Korea, as well as their immediate family members, are abiding by the quarantine measures. So we highlight this once again. And as for the last week, influenza outbreak is also below the annual average. And next, lately we are seeing some risk factors of infections. And here are also some messages to the public as well. And first, we are also seeing many risks of cluster infections increasing, stemming from workplaces and hospitals, and especially at meat processing companies and manufacturing factories, as well as hospitals. We are seeing some surges of these cluster infections, and moreover, we are seeing industrial complexes being the source of major cluster infections as well as the same for the hospitals here in South Korea. And as for the high-risk workplaces, we are also targeting intensified quarantine measures and monitoring and inspection, and we are also spreading this and expanding them to include about 1,000 sites, including factories, manufacturing sites, as well as construction sites. And we are also making sure that we intensify quarantine for foreign laborers. So all of the workplaces, we need to ask you to have a responsible manager responsible for the COVID-19 infections, and we also ask you to ventilate and disinfect your areas on a regular basis. And moreover, if you have people living at dormitories like the foreign workers, we ask you to encourage them to get tested as soon as possible. And in order to also protect the people in the hospitals, we are also making sure that the mass testings will also be conducted at Oriental hospitals as well. And it is very important to also limit the number of visitors to these hospitals, as well as nursing homes and long-term care centers. And we are also making sure that we have to have early testings and ventilation and disinfection on a regular basis at hospitals. Moreover, we also have the public healthcare workers, and they have different grades. However, starting from March, we will starting from the AstraZeneca's inoculation targeting these public health professionals. And as for the highest level of hospitals work and caregivers, we are also giving them the Pfizer's vaccine starting from this week. And we also have, secondly, increased risks of infection stemming from Lunar New Year holiday family gatherings, as well as the ease of social distancing measures. And with these easing of the social distancing measures, we are also having increased and heightened risks of infection. So in relation to these, we also will be intensifying our monitoring and inspection on site, and we will make sure that these facilities that breach these measures will be faced with stern legal measures. And as for these hospitals, we ask you to also carry out the vaccination starting from 26th, and we will also make sure that these residents at the long-term care centers will be vaccinated as scheduled. And as for those over the age of 65, we will make sure that we will plan another timeline for their vaccination as well. And as for the foreigners community here in South Korea, we will make sure that we provide guidelines which will be translated in other languages. And third, we also have increased risks of the new variants here in South Korea as well. And globally, we are also seeing more influx of these variants and more identify of these new variants. And as reported, we have 128 cases being reported here in South Korea. And stemming from UK, South Africa, and Brazil, we also have other new variants stemming from reported in Japan and the US. And we also have a high possibility of these new variants being introduced here to South Korea. And to this end, we are also mandating all of the foreign entrants, including Korean nationals, to present their PCR negative testings. And we are also testing them 3 times before they are discharged from self-quarantine. We will make sure that we identify these patients at an early pace. And we will also make sure that we have municipal governments, employees, and public servants to be designated as responsible managers for COVID-19 infections. And in order to also prevent further transmissions, we will carry out analysis and testings of these new variants going forward. And as for this week, which is the second week after Lunar New Year holiday, and this is also another week after the easing of the social distancing measures. And to this end, we ask you to continue to comply with these quarantine measures and antivirus measures going forward. Moreover, if you have visited your hometown or relatives or your family members during the Lunar New Year holiday, or if you have went to crowded, confined, and close contact environments after these meetings and after these visits, if you have any symptoms, please get tested as soon as possible. And for the next week, please consider the incubation period and refrain from having gatherings or other meetings. And also, we ask you to comply with the face mask mandatory guidelines, and also wash your hands on a regular basis. And we need to also ensure a safe inoculation for our citizens, and also ensure a safe New Year for our students as well. So we ask for your participation going forward. Moreover, we also have some plans, updates on our inoculation plans, and starting from the 26th, we have the COVAX Pfizer vaccines, which will be arriving here in South Korea on the 26th, and they will be given to about 55,000 people who are healthcare givers who are treating COVID-19 patients, and they will be carrying out at the regional vaccination centers. And this is aimed at reducing our medical vacuum. And we will also ensure that large hospitals will carry out their own inoculations. And we will also have the National Inoculation Center, and we also have the regional vaccination center which will follow, and thirdly followed by hospitals. And as this is the first vaccine to be introduced here in South Korea, it is important that we will also make sure that the vaccination centers will carry out trainings and education sessions for doctors and healthcare providers as well. And AstraZeneca's vaccines, we will be providing them to the public starting from the 9 a.m. on 25th. 25th. And we also have some 750,000 doses of the vaccines developed by SK Bio, and they will be given from the and distributed from the Gyeonggi-do Province factory. And depending on this plan, starting from the 25th until 28th, they will be distributed to nursing hospitals and public health centers. And as for the residents and the healthcare providers at the nursing hospitals, we will also make sure that they have the contract being signed within this week, and they also need to go through advanced and prior training and education. And we will also have prior and advanced inspection and monitoring before the inoculation. And we will also have the database where we could also update our information, and this will be opened on the 25th. And with this, we will make sure that with the person's number and the person's residential number, we will be identifying whether this person is subject to the vaccinations, and we will also make sure that we have a collective management of these related data. Thank you very much.
Right, that was Seong Young with Monday's afternoon briefing. So what did she have to say?
Well, first off, the vaccination preparations are in full swing, and it looks like we have a time for the first vaccination to kick off at the end of the week. 9 a.m. on Friday looks to be the first time of the vaccination. And the average number of infections of COVID-19 in the past week has risen by almost 29% from the low 400s to the mid 400s. And the capital region saw a rise by the third straight week. And Chong mentioned three major risk factors. First off, medical facility cluster infections, and then eased social distancing measures, and then the last one was variant concerns, as 9 new variant cases have been found here in the country, which raises the total to 128 variant cases.
Oh, I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, as a number of medical experts have been claiming, false and misleading information about vaccines can severely undermine our efforts to ensure public health. We have details in this report.
During a meeting with his cabinet on February 1st, President Moon Jae-in vowed to take stern action against the dissemination of fake news and misinformation regarding COVID-19 vaccines. Korea is not alone in its fight against fake news, with countries across the globe taking direct aim at the spread of misinformation, or an infodemic, as it has been labeled by the World Health Organization. So what are some of the most prevalent myths and false rumors being circulated about COVID-19 vaccines?
작년 11월, 12월에 이제 유럽이나 미국이 접종 시작하는데 당시에 접종을 못했기 때문에 일종의 이제 그런 상황 때문에 얘기가 나왔던 거고요. 그 이후에 충분하게 백신 수량은 확보됐고, 그다음에 이제 수급 계획들은 잡혀 있는 상황이기 때문에 앞으로 지금 도입된 접종을 얼마나 빨리 접종할 수 있느냐가 이제 앞으로 관건이 될 거라 생각을 하고 있습니다.
The deaths in various countries in Europe happen to elderly people who are already weakened by chronic diseases. In the case of Norwegian nursing homes where 33 elderly patients died after Pfizer vaccination, an average of 45 people in this facility died per day regardless of the vaccine. But looking at emerging US data, there's no sign of this fatal risk after 1.3 million people vaccinated in long-term care facilities.
Another rumor that's been making its rounds on social media claims that elderly recipients of the vaccine were given shots filled with a saline solution.
약제나 이런 부분들이 실제로 효과가 증명 안 된 경우들도 있는데 약을 이제 처방받으러 실제 오시는 분들이 있거든요. 그런 분들이 자꾸 이제 병원에 방문하시게 되면서 이렇게 되면 다른 환자를 봐야 되는 그런 의료진 입장에서는 상당히 좀 곤란하기도 하고 설명하기도 참 모호한 상황들이 이제 발생을 하거든요.
One fake news that brought massive tragedy includes Arirang's case when people believe alcohol intake cures COVID-19 and hundreds died from methanol intoxication. This implies fake news can threaten our life and safety.
So what's the catalyst that's fueling the propagation of fake news on cyberspace?
정보는 사실의 습득이기도 하지만 사회적 유대 기능도 가집니다. 따라서 객관적 사실과 자신의 믿음이 불일치하더라도 가족, 친구, SNS 동료들과의 유대가 중요한 사람들에게는 그 믿음을 부정할 동기가 약하게 됩니다.
Misinformation has also exacerbated vaccine hesitancy and is threatening our drive to reach herd immunity. From the early days of COVID-19, the Korea Basic Science Institute has been on the front line of the war against fake news, having launched its Facts Before Rumors campaign back in March 2020. The homepage provides fact-checked information from the WHO and the KDCA in 21 languages.
가짜 뉴스를 통제하는 가장 효과적인 방법은 진짜 뉴스를 말하는 주체가 사회적 신뢰를 가질 때입니다. 이를 해결하기 위해서는 소모적인 정치적 논쟁을 줄여야 되고 객관적 사실 앞에서 승복하고 마무리 짓는 관행을 정착시켜야 됩니다.
It is hoped that ongoing efforts by the government and individual citizens alike can eliminate the threat of fake news, making way for reliable, accurate information that we can trust.
다음 주의 상황이 굉장히 중요할 것으로 보고 있어서 앞으로 이 코로나19가 다시 안정적인 감소세로 전환될지 혹은 재확산의 기로로 들어갈지를
역사적인 국내 첫 접종도 26일부터 이루어질 예정입니다. 정부는 국가적 역량을 총동원해서 이번 백신 접종을 반드시 성공적으로 추진해서 국민 여러분께 하루빨리 일상을 회복시켜 드릴 수 있도록 최선을 다하겠습니다.
There are signs of a possible resurgence of the third wave here in Korea amid relentless cluster infections, and authorities are claiming daily tallies this week will be crucial in deciding the future course of Korea's COVID-19 prevention efforts. For more, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Good afternoon.
And I also have Dr. David Kwak from Soonchunang University Hospital. Welcome back, Dr. Kwak.
Thank you for having me.
Professor Chung, how do you explain the recent uptick in daily infections following the Lunar New Year holiday?
Yes, it is increasing. When you look back, the third wave started mid-November and had a peak in end of December, and we saw a downward until the end of January. But by that time, we have seen average increase during last week was a bit higher in Seoul and Gyeongbuk and Honam area. That is a bad sign. And on top of that, government allowed some sports facilities like a ski resort, gyms, since 18th January. And 1 week ago, 15th February, they got the level down by one step. So all the signals are from government that it is going to mitigate the restriction, so the people are following them. And we know that the movement was increased during Lunar New Year's holiday, and we'll see the circulating of viruses here and there for the time being.
I see. And amid that backdrop, Dr. Kwak, according to today's afternoon briefing, Korea has recorded at least 128 cases of variants. What are the chances of a large-scale domestic outbreak of these variants?
Well, I think there is a chance that the new variants could take dominance here. As I said numerous times before, it's really, we have to think it this way. We have to consider it's only a matter of time until the new variant actually becomes much major in the country, in the composition of the virus. So we have to take the most conservative approach in fighting against any of the new variations coming in as possible. That means that we would have to consider how, as I said before, we have to consider how we're going to prepare ourselves against these specific new variants as opposed to what we are already fighting. And we have to diversify the approaches, meaning we have to diversify the tools that we're going to have at hand. We're going to have to diversify how we're going to screen out these people because these new variants are going to be coming in from foreign countries, how we are going to screen them out and have them minimize that would affect our numbers. But eventually, sooner or later, it is going to continue to come in, and it is going to start to take dominance no matter what we do. So we would have to be better prepared in regards to how we are going to delay that happening as much as possible.
Right. And Professor Chung, what do you propose to better tackle the relentless outbreaks of cluster infections here in the country?
The government let the level down, not only in Metro Seoul area, but also in other areas. I agree with level down in non-Metro Seoul area, but I really object the level down from 2.5 to 2.0 in Metro Seoul area because we didn't see any significant decrease in this area. So in that sense, the other 6 extended areas like Gangwon, Chungcheong, Honam, and Gyeongbuk, Gyeongnam, and Jeju can decide on their own according to their number and according to their medical resources and etc. But this time, again, if you have an increase or a sustained number of cases in Seoul area, I strongly recommend to get the level up again to a 2.5.
Right. Dr. Kwak, some pundits believe the recent rise in cases may trigger a resurgence. Do you share this grim outlook?
Well, I don't personally share that idea. But I do agree that we still have to be the most careful about how we're going to go about this. As always was the case with the 3 waves that we've had so far, it always goes up gradually. It doesn't always create any sudden spike and then we have massive numbers happening. It always happens from 1 or 2 seeds that spreads to multiples of other seeds, and it follows a exponential line, so to speak. So hopefully, and my personal take on this is that we have to be careful for this week and upcoming weeks, and be careful as to take the most conservative way and most careful way of still trying to mitigate the virus and still trying to minimize any social gatherings. But in a sense that are we going to have the resurgence very soon? That is yet to be decided, I think, because if we all our nation, all our citizens come together to really be careful, despite the government's leveling down from 2.5 to 2.0 to 2.0 to 1.5. Despite that, if we be careful enough amongst ourselves, we are still going to be able to fight this off and not have any wave coming up. So my take on this is that no matter what the situation is, we have to be as careful as we can be.
Right. Professor Chung, authorities initially, this would be earlier this month, had planned on adopting a new approach to social distancing guidelines by allowing the public a greater sense of autonomy and responsibility with regard to COVID-19 prevention. What are your thoughts on this?
Yeah, one day we have to revise the level eventually, but I don't think it's time to discuss on that because this is time to terminate the 3rd wave thoroughly, completely. So the virus doesn't know the level. So we have to concentrate on that. And reportedly, the government is planning a 3-tier level. If it is if it's true, there is some question like level 1 should be an ordinary one and the usual one until the end of pandemic, maybe not this year. So the level 3, we saw the government wouldn't go to a highest level last December. Even we had 1,200 patients a day. The government didn't decide to go up to a third level. So it's a rare occasion. So mostly we'll remain in a level 2. And then at that level 2, we are treating from 200 to 1,200 patients every day. So there should be a multiple do's and do nots in there. So complicated. It's not very easy to remember and keep in mind. So I don't think it's a good idea. I don't know whether it is applied or not. And regarding autonomy and responsibility, it's a very intriguing word. And also, when you think about one strikeout policy, that is also very determined. But who is going to do that? The central government, the local government, police officer? Nobody will be responsible on site. So those things should be arranged before we are considering 3-tier restriction level.
Dr. Kwak, Korea's first inoculation will take place 9 a.m. on Friday, as revealed in that briefing this afternoon. And it will start with AstraZeneca's vaccine for those below 65 at nursing homes. And then we'll have on the following Saturday, I believe, Pfizer's vaccine for healthcare workers. What are your thoughts on this upcoming agenda?
Well, I'm very much looking forward to that, obviously. Because in regards to vaccinations and inoculations, the sooner the better, and more massively done, more better. So I would hope that following these start of the vaccinations, we would be able to obtain many more stocks of whatever the vaccinations that we could get hands on, and be able to inoculate as many people as possible. I'm personally hoping that it'll be much quickly done, that we will be able to inoculate most of the whole population of our country within the first quarter of this year. But realistically speaking, even if we can't do that, the sooner the better, and more massively done would be the better. So with the beginning on the 26th and 27th, I will stay hopeful that it will give us a good sign as to some of the medical workers and some of the people that has to deal with a lot of elderlies and sick people. They would be protected against these viruses, so they would feel much safer to go into these situations and help others to fight against possibility of mitigation and mitigating this viruses still further. So I'm going to stay hopeful with the beginning of the vaccinations.
Right. And staying with our vaccination plans, Professor Chung, the new school year for Korea starts next month, and the government has spoken of support for in-person classes for our younger scholars. Hence, there is talk about the need to vaccinate our teachers first as well. What are your thoughts on this?
Yeah, it's not a bad idea, but the KDCA is not the teachers. It's not including teachers in the priority group. So if school is open more frequently and more longer duration than last year, then we have to consider teachers to be vaccinated. But there are some considerations on that. Will the supply be sufficient for teachers? Because there are many other priority groups before the teachers, because the elderly with underlying disease and etc. And even though the teachers got vaccinated, what about the students? We know that we do not have effective vaccine so far with age under 16. But the students are staying there in their classroom whole day with other friends. And they could be one of the sources of infection. So we have to think about the effectiveness of teachers to be vaccinated. Even though teachers are vaccinated, what about the students? Then we cannot prevent the spreading in classrooms.
Right. Dr. Kwak, what public efforts do you propose for this week as we prepare for the launch of our vaccination campaign and to keep our COVID-19 numbers down?
Well, not much different before, really. We have to do our best to, keep the 3 W's, meaning wearing the mask and watching the distance, washing our hands. The situation is not going to really affect the plans for vaccination because the vaccination does not really differ depending on the status of the people, meaning whether they had been infected before. As long as they are not concurrently infected, anyone can get those vaccinations. So I don't think the situation that we're going to face this week is really going to affect the plans to vaccinate those people in the nursing homes and also for the medical personnel. But in a general sense, we just have to keep fighting so that we don't spread the virus amongst ourselves, so that enough people will be vaccinated safely, and then that'll start to take toll or affect, in a much better sense, on the national level of mitigation of the virus.
Right. One final question, Professor Chung. About 94% of those at the top of the priority list for AstraZeneca's vaccine have responded favorably to receiving this vaccine. How do you assess this finding?
Yeah, it's a very inspiring news, good news. And that reflects the patients and workers in the nursing home, in the long-term care facilities are eager to be prevented from any kind of vaccine. I myself would get my own vaccine when my turn comes, regardless of a brand name. But I have a couple of vaccines in mind I would prefer, but as Dr. Gwak said, we have to complete the vaccination as early as possible in as many people as possible. So the trust on vaccine is very important. So the government should concentrate on keep the trust in the vaccine. And they should prevent the fake news spreading, and they should keep the information very rapid and in a very transparent manner.
Right. All right, Professor Chung, as always, thank you very much for your thoughts. And Dr. Kwak, thank you for your insights.
Thank you.
Right, that ends our coverage for this Monday. As our panelists today have been urging, do seek to do your part in keeping our COVID-19 numbers down by washing your hands, wearing your face masks, and watching your distance. I'll be back tomorrow with more on the pandemic. See you then.